Hello, lovely viewers. Welcome to another beautiful segment of What to Do If, right here at City Star TV on your favorite program, Abatanye. As I promised you, I'll be bringing you this segment every other week to tell you what to do in case of emergency situations involving your children. Now, before I go on to today's topic, if you haven't subscribed, please do so and follow us on all our social media handles on Facebook, TikTok, Instagram, and Twitter. The name is City Star TV. I'll give you some few moments to do so while I take a short break. Hi, welcome back. I believe you have subscribed. On to today's topics for discussion, I'm going to start you with what to do if your child is choking. Now, this is a spur of the moment thing that I'm going to advise you on, but as I always keep reminding you, when the thing happens, go to the hospital. But in case of emergency, sometimes there's some first aid techniques you can apply, and this is what you do if your child is choking. So sometimes we can give our kids food that have lumps, and sometimes you don't even know, no matter how smooth it is, the child can choke on this. And then you start to see that your kid is choking, they're unable to breathe, they're unable to swallow what they've actually taken in that they're supposed to swallow. And this is what you do. So first and foremost, if your kid is standing, you need to stand behind your kid. If the kid is seated, you need to kneel behind your child. Now, when you kneel behind your child, you need to first create a fist, as in kotoku said, then I be before your friend. You fold your hand like this, you create a fist, and then you put it between your child's navel and their rib cage. So somewhere between your child's navel and their rib cage. So it will be almost to their chest, but not to the chest. So you target it and you put it between your child's navel and their rib cage. And now that fisted hand, you use your other hand, the one that is not fisted, you also use that to hold on to your fisted hand. Now, when you do that, it will basically look like you are hugging your kid from behind. And you're going to need strength here because your child, remember, let the fact that your child is unable to breathe and choking on food motivates you to be strong. Now, you're going to need to exert a lot of strength whilst you put your other hand on your fisted hand, which is placed between the navel and the rib cage, and then exert the strength and then push it inwards and upwards. So you push your hand inwards, as in you're tucking in the tummy, and then upwards, like you're pushing the food that is not able to go down, back up. You need to do this a minimum of 5 times. You need to try and do that. Exert as much pressure as you can to push the tummy inwards and then upwards. When you do this right, whatever thing that the child is choking on, the force you exert will cause the child to spit it out. So if it was a lump of food or a bone or something that your kid is choking on and is unable to swallow, when you do this, the force you exert will cause the child to spit it out, thus enabling the child to be able to breathe again. So that is what you do when your child is choking. And you need to be very cautious. You see, the child is young and fragile. When you are doing this, make sure not to put too much force on the rib cage, or you can actually bruise it or break it. So despite the fact that you are going to be on adrenaline and maybe acting out of fear and trying to save your child, you also need to exert caution. Now, when you're doing this, you do not hurt your child, you do not cause further harm to your child. So that's what you have to do if your child is choking on something. You fist your hand, you place it between the navel and the rib cage, you use the other hand to hold it, push it in inwards and upwards, a minimum of 5 times, so your child can cough out whatever it is that's causing the child to choke. So I have this and many more to tell you today, so stay tuned. Welcome back. So on to the next topic for today's What to Do If Your Child segment. I'm going to talk to you about what to do if your child is constipated. Now, this happens a lot of times where the child has abdominal aches or tummy pains that results as because of complications from constipation. And this happens because of sometimes the dieting and a whole lot of factors actually. And you can take your child to the hospital for treatment. But in the meantime at home, these are some of the things you can do if your child is constipated. Now, as a parent, you need to know, is your child hydrated enough? Are you giving the child a lot of fluid-based meals? If not, please try, especially water. Try to give the child a lot of juice. Also introduce fiber. You know, for instance, one of the best fruits I'll recommend is orange. When your child is constipated, you can give this child orange and try and get the child to eat the fiber not just the juice, but try and see if the child can also eat the fiber in the fruit. Try and introduce a lot of fiber like oats and all these things into the child's diet. It can help when the child is constipated. Now, more times than not, there's something we call enema. Here in our African communities, at one point in time, but the herbs that our grandmothers and our aunties and our great grandparents use, we don't know, they may be infected, they may not be sterile. So I will not advise that you do use those herbs. But there are medical enemas available that you can see a medical practitioner, or you can go to a pharmacy to make inquiries about, and then you can get an enema. And this will also help you to help your child ease their bowels. Also, try if you're giving your child a lot of soda or tea. And when I say tea, I mean the tea bags, not the cocoa and all those things. If you're giving your child a lot of soda and all these things, you need to also stop. Now, in worst case scenarios, you can also give your child, you can go to the pharmacy and they'll give you a laxative for the child. And these are in worst case scenario when you know that you absolutely need to, because sometimes these laxatives too can, also cause some problem for the kids. So these are the measures you can take when your child is constipated. Like I said, if you're unsure, always choose the hospital. There are lots of experienced medical practitioners there. There are doctors, there are nurses, there are midwives. When you get there, they will attend to you and tell you what to do. But in the meantime, you can try any of the above listed methods that I talked to you about. So that's what you do if your child is constipated. I have a lot more for you, so stay tuned. So welcome back. We have been discussing what to do if, I think we've covered what to do if your child is choking and what to do if your child is constipated. Now, sometimes we don't know, people in our community, we call something HA or epilepsy, but those are not the only causes of seizures amongst our children. Anything, per our previous discussion, if you haven't watched some of the episodes, you should go back. There was a discussion where we had about measles and tetanus, and sometimes these complications can even cause the child to seize. So any other thing can cause a seizure in a child, and sometimes we don't even expect it and they happen. Like I said, these are remedies for spur of the moment incidents. So this is what to do if your child has a seizure. You're standing with your child, or your child is right there, right in front of you, and then they start seizing. This is what to do. Now, when this seizure happens, most often it's associated with a lot of shaking. You realize that your child is spasming or dahona or whatso. Now, what to do is, the first thing you do is to make sure that wherever position that your child is laying at, baby or dano, and then you also be brought better form, and I say obe pra. So you make sure that if your child is, you put the child in a safe position. Now, when that happens, you don't really know what is happening. Most of the times, parents, out of fear, we grab the child and then we carry them to the hospital, and then we can end up doing more harm to the baby. You need to wait it out. You need to wait the seizure out. You need to immediately call emergency services, call an ambulance, and while the ambulance is coming, you need to wait it out. So you make sure that you don't hold your baby still, or you don't hold the child still, or force. If the child is clenching their arms or their legs, you're going to force them straight. No. You make sure nothing gets into your baby's mouth. And because if it's happening, they can even bite on it and then end up choking themselves. Whatever it is. Sometimes they are drooling and you want to close their jaws or cover please don't. You need to be patient. You need to know that there's something that is happening to your child, which is why that thing is happening. That's causing the seizure. You need to wait it out. Stay with your baby. Don't rush and leave your baby lying there. You never know what will happen when you step away. Stay with your baby. Keep your eye focused on your child. And then try to make sure that the environment, baby or dano, it's safe. Bibi in tone so and now unrolling kobo form ewo baby. What I say, whilst you wait it out. Don't force it. Don't try to think you can stop it. Don't pour water on your baby to think, say, no. Wait it out. Don't try to stop what is happening. There's nothing you can do at that moment than to make sure that you keep your baby safe, and then you wait it out and clean the drool, because sometimes they foam and they drool. So when this is happening, clean the drool, and then once the seizure stops, rush your baby to the hospital. You don't know what caused it. So the minute the seizure stops and your baby it's normal, just rush your baby to the hospital. Don't even wait. Don't wait for anything. Don't wait for any kind of, if the ambulance you've called is not even available yet, rush your baby to the hospital yourself. That is what you do if your baby has a seizure. Now, sometimes these things happen, and also sometimes your baby can even pass out. It could be from exhaustion, it could be from a sickness, it could be from any number of factors. This is what you do when your baby faints. This is what to do if your baby faints or passes out of the blue. Now, the first thing you do is new by your baby. You need to make sure that you check the baby's breathing. When the baby passed out, if he's still breathing or not. Now, if the baby is not breathing, there is a cause for alarm, because you need to be scared, and then you need to immediately, if you know CPR, you need to try to see if you can administer it, because you never know if the baby stopped breathing that long from the time wherever you are to the hospital. A lot can happen on the way. If you know CPR, try. So if you don't know, as a parent, I think these are certain things we need to be able to learn. You can read about it. You can go to the hospital to see how they do it. So have somebody, an experienced person, teach you. You open your baby's mouth, you breathe in, and then you pump the chest gently. But there's a method about it that a more experienced practitioner can teach you. You need to administer CPR. Also, there's a way to jolt your baby. That is, you lift their legs from their knee to their lower thigh to the buttocks, and then you bend it towards their hearts. So you raise the legs and then you bend it. So you realize that you are bending them from their waist to their buttocks down, and you're bending their legs towards their hearts. Now, this causes blood flow that to move straight into their arteries, straight into their hearts, and then it can cause a jolt. If the baby is not breathing, it could help. The baby is very still and has passed out. This could also help to cause a jolt that could wake your baby up. And all this, meanwhile, make sure that you have an emergency vehicle ready for you to carry your baby to the hospital. This, when your baby is not breathing, these are things you can do en route to the hospital. You are not waiting at home for your baby to wake up. You're putting your baby safe in the back of a car, and you're practicing these techniques on the baby whilst you're rushing to the hospital, because this is not something you stay home and try to handle by yourself. So these are the maneuvers you can take when your baby faints out of the blue and you are en route to the hospital. I have a lot more for you, but today we'll discuss this very 4 topics. So as I told you, every other week I'll bring this what to do if segment your way, and keep watching Abatanye. So you need to subscribe. If you haven't subscribed to our YouTube channel, you need to do so, or you miss out on all these episodes, these fun, educative episodes. Hit the notification bell. The minute the episode drop, you'll be alerted. You will know. If you haven't followed us on all our social media handles, please do so. It is Facebook, TikTok, Instagram, and Twitter. The name is City Star TV. I am your host as always. I love you just like you love me. I'm Nanaya. Catch you same time next week.